Morning, everyone. Today, our topic is quite long, seems too much, but basically, these are 5 minutes topics, so that's why I am putting them all together in one lecture. So, maybe this lecture will not last more than 20-25 minutes, okay? So, don't worry about that. So, um, let's start talking one by one about all these things. The first thing which I wanted to talk about is acute phase reactant or acute phase reactants. Now, what are acute phase reactants is basically whenever there is, you can say, in the body, whenever there is any inflammatory process going on, inflammation is going on. So what happens, like the plasma concentration of different proteins, it changes. For example, we can phrase it like this way that proteins um, in plasma changes in response to inflammation, right? Now, one important thing, like many proteins, their level goes down, okay, and you can say many proteins in the plasma, their levels or the level goes up, okay. So whenever the level goes down, guys, we call that thing as um, negative, again, acute phase reactant, okay. And whenever their levels goes up, we call them as positive acute phase reactant or reactants, okay, or proteins, okay. So acute, these are all because they are proteins, so we can call it as acute phase reactants or acute phase proteins. Both are correct, so I can include over here like proteins, right? So you can say like acute phase positive acute phase reactants or positive acute phase proteins, or negative acute phase reactants or negative acute phase proteins. So in response to inflammation. And now, guys, like there are many positive acute phase reactants. For example, the most important of them is called as CRP, okay, C-reactive protein, which I will discuss um, a little in more detail, you can say. Now, basically, what is happening in these patients is simply, um, you can say, like these proteins are basically in response to, like, is the response of the immune system or like the physiological processes which are going on inside the body. For example, whenever there is any inflammatory process, what happens, like the CRP goes up. So CRP is an acute phase reactant, positive acute phase reactant. So CRP is a positive acute phase reactant. Um, Now, not just this one. There are many like ferritin, which is a stored form of iron. Um, it levels goes up in the body in the form when there is inflammatory. Hepcidin, okay. So hepcidin levels also goes up, and there are many other things like complement factors, okay, they go up in response to this thing. Like as I told you, there are many acute phase reactants or like positive acute phase reactants, like three I write over here, three I have written over here: fibrinogen, prothrombin, all these things goes up. And when it comes to the negative acute phase reactants, so these are the proteins which basically goes down, their level goes down, or their level go can become less in response to inflammation. For example, albumin is a negative acute phase protein, or transferrin. Uh, Transferrin is one of them, and there are many others like antithrombin also is there. So now see, simply either these are going down or these are going up. Simply they can be used as marker of inflammatory process, okay. uh, for example, like all the proteins which goes down, like why they go down, it is seen like basically the body, they decrease the synthesis of albumin, transferrin, antithrombin, transcoding, things like this, to save the amino acids to produce more and more positive phase reactants, which are more efficient and needed to fight the thing. Now, this is just to make you the concept, give you the concept about what is acute phase reactant or proteins and what are negative one, what is the positive one. And as I told you, the most important among them is called as CRP, or you can say it is also called as C-reactive protein. Okay, so now C-reactive protein or CRP, um, what you can say, it is basically present in the blood plasma, and it is used too much in clinical practice. Whenever anyone have inflammation, any infection, any neoplasm, so we go for to check for the level of CRP, and whenever it is raised, of course it point towards like there is something going on. For example, um, now, C-reactive protein, of course, like all the other proteins, it is produced in the liver. It is an acute phase reactant, or you can say a positive acute phase reactant. It will be raised because it's a positive one in inflammation and infection. So not just infection, you can say inflammation, infection, and neoplastic processes, right? So it levels goes up. So now, if you remember one more thing, which is called as ESR, ESR behave in the similar fashion. And I think I already explained you what is ESR, that there's more and more plasma protein, so it causes more and more Rolex formation. So that's why CRP or ESR, they together called as inflammatory markers. Okay, so that's why we do these things, just to check like if there is any inflammation going on in the body or not. And there are many things, now like just to tell you, if can name as many as inflammatory conditions as you can, of course you can tell. For example, CRP will be raised in conditions like any inflammatory condition, guys, name any, and you will find like they will be raised in that condition. Okay, simply, no matter it is SLE, no matter it is systemic lupus erythematosus, it is rheumatoid arthritis, it is cancers, it is multiple myeloma, and the list continues, right? So this is about C-reactive protein. The other thing which I wanted to tell you is uric acid, right? Uric acid, or you can say urate. Like many different labs, they write it as uric acid or urate. So now, what is that, guys? As we know that urates are produced during the metabolism of purines. Okay, and now it is excreted by kidney. Okay, now whenever like the blood levels of uric acid are high, we call it as what? Hyperuricemia, right? So hyperuricemia, like increased level of uric acid in the blood. Now, what are the causes of hyperuricemia? For example, if someone is having increased purine consumption, for example, or you can say when there is impaired uric acid excretion. Okay, of course, like it is going to go up. Or you can say, like, for example, when there is increased uric acid production. So now, purines, by the way, we take it in the food in the form of drinks, okay? And now, what is the importance of uric acid and why we do that? Like uric acid can be raised in the body and the patient can be asymptomatic. So many of the asymptomatic people, or the people who are completely normal, maybe you will find that uric acid is normal. But why I'm writing over here is what? That, sometimes, there is a condition called as gout. So what is gout? Like, there is like the patient, they presented with too much pain in the joints, most commonly in the big toe. Okay. But there could be any other joint. So like that gout is linked with this condition, like the uric acid levels. Um, so most of the time, whenever someone present with gout, or you can say monoarthritis, we go for measuring uric acid levels. Okay, so that's the importance of this thing. So you can say a high level of uric acid supports. I'm using the word support, right? Supports the diagnosis of gout. Doesn't mean like anyone who have hyperuricemia means they have gout, because I told you many people who have hyperuricemia, they are completely normal, they are asymptomatic. Okay, so and one more thing, for example, it could be like this, like someone who have attack of gout, maybe their uric acid levels come back as normal. That's also the condition. Okay, one more thing is something called as sweat chloride test. Now, this is such a short topic that I told you as that, um, like these are 5 minutes topics. So basically, this one is basically a 2 minute topic. Why? Because I don't have to talk about uh, uh, how we do this thing. Okay, rather I just want to talk about why we do this, right? So sweat chloride test is basically simply we just do for one thing, and that is there is a condition called as cystic fibrosis. Okay, cystic fibrosis. Uh, too common in common in white people, cystic fibrosis. Now, basically, cystic fibrosis is a problem with the genes. Okay, it's an autosomal recessive type of condition in which there is uh, mutation of a gene. Now, the gene basically that you can say encode or that have the information uh, of mutation of a gene that encodes for CFTR. Basically, what is this one? This is cystic fibrosis transmembrane conductance regulator gene. Okay, so this CFTR or cystic fibrosis transmembrane conductance regulator is responsible for um, chloride ion transport across the, you can say, epithelial cells. Okay, so what I'm saying, like cystic fibrosis is a genetic condition, autosomal recessive. They have abnormal gene or mutation in gene which encodes this thing, and this is responsible for chloride ion transport. So remember, like someone who have this thing, the abnormality of this gene, so they have abnormality of the chloride ion transport. Okay, so when there is abnormality in the chloride ion transport, simply, guys, what is cystic fibrosis? You can understand in just this line that they have, you can say, concentrated secretions, or you can say viscous uh, viscous secretions. Okay, so see, their sweat is having more chloride, their lung secretions have more chloride, their GID secretion have more chloride, their pancreatic secretions have more chloride, even the movements, or you can say their cilias which are present in the ovarian or in the sexual reproduction, they are also abnormal. Why? Because they have viscous secretions in the pancreas, in the lungs. So now simply they have abnormal sweat gland function as well. Okay, so simply when they have abnormal sweat gland function, what they have is basically they produce high concentration of sodium and chloride in their sweat. Okay, and that simply their sweat, you can say, sweat glands. So the sweat they produce, is more salty than the normal people. And of course, like we do genetic testing to diagnose CFTR or like cystic fibrosis simply, right? But we can do something called a sweat chloride test. So what sweat chloride test do is simply, what we do is like we stimulate sweating. Okay, we stimulate sweating so that the patient produce more and more sweat. Okay, because we have to see like what is the consistency of their sweat. Okay, and then we collect that, uh, we collect it for analysis. And once we analyze, so you can say like 100 milligram of the sweat is collected. So when we found that there is more than 60 millimole millimole per liter of chloride. Okay, so we say that the test is positive. Okay, so the test is positive when it is, you can say test is positive. So the test is positive for more chloride in the sweat. Okay, and what you can say, we say like that they have like more sorry, we say that the test is positive because the test have like the sweat have more and more chloride. Okay, which is more than normal. Okay, so we say like the patient may have cystic fibrosis, may have, because the diagnosis should be made on the gene, studying of the gene, right? So this is like how we do, why we do sweat chloride test, right? There are what you can say, the conditions which can cause false positive results as well, but like of course that is not our discussion right now. The last thing is called as tumor markers. Okay, now this is also very interesting thing in diagnostics, and of course like when you will keep on studying different conditions, you are going to study different tumors, and you will study about different tumor markers. And you can say like, here I will give you the concept why we measure tumor markers and what is the use of that, and what important tumor markers which you should remember, because the exams like USMLE and PLAB, they give questions like this, that the patient has presented with this condition, and when we do the blood testing we found like this tumor marker is present. So this will give you like easy marks, like if you can pick the keyword and if you remember that what is this tumor marker used for, you can answer the question correctly. So simply, what are tumor markers? They are simply, you can say, biomarkers uh, in the urine or in the blood, okay, or any fluid, okay, uh, and they are elevated in presence of cancers, okay, or malignancies, okay, malignancies. So now, simply, of course, as you can see, that these are markers which are present in mostly blood, but can be urine or in any other secretion. Okay, and whenever they are raised, they will point us towards like the presence of certain malignancies. So, or neoplastic conditions simply. So most of the tumor markers, they are associated with certain conditions. For example, one very important one which we have to remember is alpha fetoprotein. Okay. Now, alpha fetoprotein is a tumor marker or is associated with hepatocellular um, carcinoma, and also it can be present in, you can say, testicular teratoma. Okay. One more tumor marker is called as beta HCG, or you can say human chorionic gonadotrophin. Okay. Now, or beta, this is the short form of what, beta HCG. Now beta HCG is present in testicular carcinoma as well as in seminomas, which are also testicular carcinoma or testicular tumor or choriocarcinoma. Okay. One thing is called as PSA, or prostate specific antigen. Now PSA, it is also not, we write as PSA. So simply it is raised in prostate carcinoma. Then there is something called as CA-125. Okay, very easy guys, ovarian carcinoma. Then there is something called as CA-19-9. Now this one is present in pancreatic carcinoma. And there is CEA, or CEA means carcino, CE, embryonic A antigen. It is present in colorectal carcinoma. So now guys, the important thing over here is, these are not just the markers. There are many more. I think if you will Google it, you will find many more. Like, I write about CA-19-9. There is CA-27-29. There is CA-15-3, which are for breast carcinomas. What I write over here is the important one which you can get in exams. I'm talking about the basic exams like USMLE or PLAB or AMC, things like this, or PMDC, for example. So, okay, yes, one very important thing, calcitonin, though rare because they ask this question from a different point of view. They can be present in medullary thyroid carcinoma, right? But mostly, the thyroid carcinoma, they ask from a different point of view. So what I'm saying, like, there are many tumor markers, okay? Not everything you have to remember, but these are the important ones which you must remember by heart, okay? And what is the usage of this thing? Simply, okay, now the game of specificity and sensitivity will come. Most of the tumor markers are fairly non-specific, okay? And many of the tumor markers, they can be raised in more than one type of carcinomas. This is a very important point. The exceptions are few. For example, alpha-fetoprotein, beta-chorionic gonadotrophin or beta-HCG, or prostate-specific antigen. These three are specific, you can say. Rest others can be raised in more than one underlying cancers. So we always require tumor markers when we get some clinical evidence of some underlying disease. So we see the reports in relation with what you can say the clinical or history findings, okay? And tumor markers, by the way, you can say the uses of tumor markers, like mostly they can be used in clinical practice. Number one, for example, you can say to make a diagnosis, okay, like when it is specific for certain condition, or for example, you diagnose the cancer and now you treat it, you remove it, and you have to monitor, or if you are giving some chemotherapy or radiotherapy, and if you want to see either the tumor is regressing or going back or not, so you can say we can use this thing for disease progress as well, okay, to see the decreased progress as well. So remember guys, very important point, always interpret tumor markers in relation with the clinical findings, okay, clinicals or history findings. So these are the main two uses of tumor markers, though there are other uses as well. Sometimes we use it for screening purposes, okay, like when you want to see if someone have any type of cancer or not. So screening purposes we can use as well, okay. So this thing, so diagnosis, or for example, you already suspect or you had highly suspicious of certain carcinoma, so you are just doing this test for confirmation of cancer, okay. So you will order that test just to confirm your finding, okay, this is the cancer, okay. And yes, sometimes it is done for staging as well, but that is not so important, right? So this thing is the important thing, and these are the tumor markers. And the tumor markers which are right over here, it's better to just remember them. If you can find a list on the internet about the tumor markers, but it's not important to remember all of them, because very low chances they are going to ask you about this thing. So thank you so much guys for listening. and I will see you in the next lecture.